Mhm.
All right. This is a time where thank you to Dr. Fairchild and Dr. Bender for being willing to come on and talk with the task force about some of the things that we just kind of really need to be reminded of. I think it's really helpful to just be reminded, as well as some people just having some questions that they really wanted to ask. As we, honesty, are also kind of recovering, not recovering, but still grieving and thinking and processing through the losses that we've recently had in our community. So this was a time where I'm just really grateful for y'all to be able to say, yeah, we'll come. You know, we might have some things we want to bring, but also open for questions. So to those who are here, know that this is a time for you to ask questions. I will say, as you know, being here for the last years, it is interesting when people pass because sometimes we don't get to know what's going on, and that's for the privacy of that family, which makes total sense. But it does sometimes leave a huge hole in community around, like, what should we know? Are there things that we should be doing differently or understanding? And so this is kind of our attempt to maybe put a little bit in that hole. Just know, to those who are on this call, we will protect the privacy of those who we know the best that we can. This is not about sharing specific information. This is about us being very general about our understanding. So we will try to make sure, even if we accidentally, we got to pull back from that, try to not use names and anything like that, but also just try to get, you know, your questions answered. From that, task force wise, let's see, what are we up to? What upcoming events? Y'all know that in June there will be a new spa day. And so if you are interested in signing up, we will be having something to come out via email in the text group. So you can sign up for acupuncture, reflexology, massage therapy. There's also a yoga class that is offered twice a month on Wednesdays. It is virtual. However, we have been allowing Sophia, our yoga instructor, to also do some one-on-ones. So if you are in a place where you want to do a one-on-one, also in the hospital, she's been coming in to do a little bit of that work. So you are more than welcome to reach out to us if that is a need. Thank you all for joining us. And with that, I'm really going to pass it on to Dr. Bender and Dr. Fairtrend.
Hi, Foxy and everyone. First of all, thanks for inviting us. I think it's always nice to be able to talk to our community and answer questions. It's always hard when we're going through these times and I think if anything, every bad situation should help us move forward, and I think understanding how we can do better, how we can help each other, and hopefully, yeah, prevent things like that to happen. It's yeah, overall, like I'm glad to be here, and hopefully we can get a lot of good take home messages or actions that we can implement in our lives from this conversation.
And I'd agree completely. And I think one of the things that's so hard with sickle cell is things can come at you from so many angles. And with time, it's easy to, get complacent and say, oh, I've dealt with this or that before, and then stop being as diligent as, sometimes is called for. And maybe talk about, why it can get so complicated so fast at some point. But it's mostly to see what questions you all have and how we can help you all, because it's about what you guys want.
So are we going for questions from the beginning?
Yeah, shoot away. It's
right.
whatever you guys want to start with. I think one question will lead to the other, so it's
Okay. Bender, I think one of the things that has come up, and I know that you wanted to kind of really speak to the importance of infections and really paying attention to that. I don't know if you can kind of give a general overview of that.
why don't I do it sort of very general, and if people want to dive deep, that's always great. I think, especially when kids are young, everyone learns about how in sickle cell, it makes it so your spleen doesn't work as well. And you need your spleen to fight off certain kinds of infection, like the one that causes strep throat. So things that are normally really, not so severe can be really, really severe in sickle cell. I think what's harder to sort of tie in sometimes is how an infection can be so dangerous and feel like more than just an infection. I think it's important with sickle cell to remember that the vaso-occlusion, the shutting down of blood vessels, right? To really prevent that, you want to keep blood flowing as fast as possible. So how do you do that? Everyone knows about fluids, about staying warm, just moving around helps blood flow. But what sometimes people aren't aware of is the white blood cells that fight infection are big and sticky and slow down blood flow. And anything that causes inflammation, which turns on white blood cells and gives you more white blood cells and making them stickier, slows blood flow. So infection, you try to fight it with your white blood cells, and there's more of them, they get sticky, so it slows blood flow. So you can start having sickle cell complications. So what's that mean for your body? Now it's not like you just have a strep throat attacking your body, but then you've got sickle cell being activated that can attack parts of your body. So, they both sort of come at you in different ways, and that can just escalate really quickly.
So when I hear you say inflammation, so what can we do? I know I take turmeric, and some of the docs that I see have said, oh, that's a great thing to take for inflammation. So how can this community, what are the things that they can do for inflammation that are maybe, everyday vitamin or foods or what? Yeah.
I see Dr. Friend smiling. That's a fantastic key question. And one of the problems in all of medicine, but especially in sickle cell, is there are those things that make sense logically, and there are those things that have been proven, right? So an anti-inflammatory diet, turmeric, things like that all make a lot of sense, okay? But if you ask me, if you look at 100 people with sickle cell that eat really carefully and take those supplements, and another 100 that don't, how their lives compare, no one knows. So it makes sense, there's not going to be any harm of eating well like that. But I can't stand here and say, if you do this, it will help. My guess is it will, but I don't know.
Mm-hmm.
Yeah, I agree. I think the problem with inflammation, there are two versions of inflammation, if I can say that. There is some degree of inflammation that happens all the time in patients with sickle cell disease, and because of the red cell breakdown, because of the things that are just chronically happening there. And then there is like acute inflammation with like an infection. And I think while we have better answers as to how to fight inflammation and infection, because of course, for example, you want to get the right antibiotics for the infection that you have, and that's going to help like dampen the inflammation and solve it faster. I don't know that we have good answers for the more chronic inflammation that happens in sickle cell disease. And keep in mind that it's not exclusive of sickle cell disease. I think the reason why we can't possibly argue against following a healthy diet and using certain supplements is because we we recognize that other more common diseases also contribute to inflammation, even by a little. Like if you have like obesity, it can contribute to some inflammation. If you have diabetes, you can contribute to some inflammation. Any degree of kidney or heart disease can also contribute to that. So of course, and talking about a healthy diet will help with all of those other things that can contribute to more inflammation. So it's really hard to say no to those daily things that we can do. But I think that what I can say is that we want to also manage any other health conditions that we have as best as we can, because that will also help reduce inflammation and probably reduce complications in sickle cell.
And along those lines, I mean, Peggy asked the key thing. So that kind of prevention with diet and all is great. But if you can't completely prevent it, right? No one can completely prevent it. What can people do? And this is where that painful sort of constantly being diligent and being aware, right? And that there's different kinds of inflammation. If you get hit really hard or in an accident, that's inflammation. If it's infection, if it's just sickle cell itself, it's inflammation. So that if you notice something beginning to get worse, just staying aware that it could get worse very quickly, right? And
so what might be an example of that? Is there an example that you can give me at least of that?
So let's say you have a strep throat or a skin infection, right? And you start off just feeling a little punky, a little low-grade fever, a little achy. That's inflammation going on, right? And those infections like that aren't going to be real, severe, just as they are. But very quickly, as an example, they can make it so you start sickling more. So you might start sickling in your lung, right? And that can progress to an acute chest. Or, you might start getting it in your kidney. So you could start having decreased kidney function. Now you can't metabolize things as well. And some of the medicines you're on aren't cleared as well. And that can lead to problems, and that can start affecting your liver. And then your liver's not working as well. And that leads to other problems, and things can sort of spread and expand from, a little abscess on the skin or a strep throat to now all these different organs starting to get irritated or damaged.
So and you said that can happen quickly. It can slip into
sorry, if you could see me closely, I'm sort of tearing up and shivering because it can happen. It can be so frightening and petrifying how quickly it can change, right? And everyone is standing around saying, what's happening, right? How could this be? Someone, looks so good, 2 hours ago, a day ago, a week ago. How could it happen that quickly? But it really can.
So it just spreads like wildfire per se. It just went.
The tough thing is it can. And as all of you know, I'm sure everyone has had little infections like that and they go nowhere, right? So most of the time it's not a problem, but you can't, I can't, no one can just say, okay, this time it's definitely going to be safe. And this time it's going to get bad fast. We don't have those tools yet to really guide us that way.
So it sounds like you're saying awareness is really important. And if if you are aware of a scenario that you just said, that you do have some kind of infection and it gets worse, you should probably see somebody and probably get on antibiotics soon.
I think
Yeah.
see something or at least talk to someone.
Okay.
Yeah, so
But would it
sounds
be
like
better?
the message is to be aware of any kind of infectious process, 2, be proactive, and 3, do something about it, or at least see someone about it.
Yeah, that's I think there are simple things that we can do so we can more quickly identify things are not going well. Because again, I agree with what Bender just said. Most patients will have small infections and that won't spiral out of control. So how do we know if this is a real risk? There are certain infections that are more likely to cause this to spiral out of control. So the bacterial infections like strep throat are really like something that we want to be aware because of the differences in the immune system. I just want to not forget to say that I know we mentioned the spleen and how it doesn't work well. So even though you're probably aware that some people will have the spleen like almost vanished, it gets really atrophic as patients get older. And for other patients, you keep the spleen is sometimes even bigger than normal. It doesn't really matter. The spleen doesn't work as well because of sickle cell disease. So the risk of an infection getting out of control exists for everyone. But the thing
So it doesn't matter if you have your spleen or not. It can
doesn't
still
matter. Exactly.
Okay, well, that's
Maybe you got it removed surgically. Maybe it just vanished because of recurrent pain crisis affecting the spleen, or maybe it's big. It doesn't matter. It won't work normally because of sickle cell. But the thing is, taking your temperature, right? So you're not feeling that well. If you're spiking a fever, you're more likely to need antibiotics. You really want to touch base with the provider and make sure that you don't need antibiotics. Sometimes just paying attention to the pain. It's if you're having like a sore throat and you have a strep throat and you're getting proper antibiotics, maybe it will stay that way. But if you start seeing that the pain is changing and suddenly like you have chest pain and back pain and it's spreading everywhere, this is also not a good sign. That's that's something that we want to treat earlier rather than later. And finally, sometimes it is about like a simple skin infection. You're getting antibiotics for that, but you're feeling unwell. You can feel that the anemia is getting worse. You can feel that something is wrong. You need to see someone. You need to get tested. It might be that the anemia is getting worse, and that's how it kind of starts to spiral out of control.
I think as people get older, building on what was just said, it's both easier and harder, right? The harder part is you get to be older and you've been through the drill so many times of feeling a little off, and you go all the way to the hospital and spend hours in the emergency room, and it's like nothing. So it's easy to just start saying, you know, I'm not going to deal with it this time. What's better as you get older is, just as Dr. Fertram was saying, as you're older, you have a better sense of, wait, something really doesn't feel right. Maybe I've only got a little, infection on my skin, in my teeth, something like that. But something in my whole body just doesn't feel right? Which little kids aren't good at, right? I mean, they may cry, but they can't communicate it. So, if you ever start really feeling like, you're feeling off or worse than you would expect, that's really a time to speak up and get checked.
Can you all speak? Oh, go ahead, Franklin.
I actually wanted to share that what Dr. Bender is describing is exactly what we experienced in 2013. Right? our daughter was at school. She was looking okay. She came back from school. She was sounding like, she had a sore throat. And she was pretty much looking fine. And then she went to sleep. And then we realized she's having trouble breathing. So we kind of rushed to the hospital. By midnight, the doctors were telling us things are not good, right? She already was developing an acute chest syndrome, right? And there is no way we could have thought that it was going to happen because she was in school, she was playing, she came home, she did homework, and like within a few minutes, she just changed from someone who was very active to someone who was so severely sick that ended up in the ICU.
Wow. Thanks, Franklin. I'm navigating. I'm trying to face that reality and not be, not be so afraid and let kids live. It's this balance, the balance of this. Woo!
And that's, that's the
only-
torturous challenge, right?
Right.
Of living a full life and relaxing,
Right.
but also not putting, yourself or loved ones in danger. And that's such a hard and personal struggle.
Well, yeah, and especially when they get older and they have to pay attention to that stuff, when they're on their own, and things happen and they really don't pay attention to it. I think there's.
Yeah. But awareness
Yeah,
is better than not knowing. So
Right.
better to become aware. Can you all speak to, because, people think infections and they think certain things, but they don't necessarily think dental hygiene and the importance of your teeth. So can you speak to that as well as you're talking through infections?
Yeah, most certainly. Dental hygiene is a challenge in our whole population in general. So it's not exclusive of sickle cell for certain, but we find that you can get big problems from dental hygiene. Again, in the general population, we also see problems. We have a lot of bacteria in our mouths, and there's always an opportunity for that. For those bacteria to just live in between the teeth and cause infections there. And sometimes it's more superficial until it's affecting the gums and until it's going inwards into the bone. I can't recommend enough that patients see a dentist, see a dental hygienist at least once a year, probably more than that, depending on what issues you have. Because those are things that can really become very difficult to treat. The teeth, we don't think about that, but the teeth are very superficial in terms of you can get a bad infection inside your bones really quickly because it's really close to the surface. So we want to really prevent that from happening. Of course, if we need more dental work, it might lead to needing to go several times to fix a problem, and sometimes it gets really complicated. As you know, as patients get older, we might have more bone problems. There is such a thing as having a bone infarct or something affecting your jaw, so that might also make dental issues more complicated. But even the smaller things, even just that chronic gum disease, we want to treat that. That is a source of inflammation, going back to what we were talking earlier, but it's also where bacteria will most readily be able to invade the body and cause infection. So we want to take good care of our teeth because it can really become a dangerous infection there.
So a confession here. I don't always go to the dentist as they would like, and I don't floss not enough. And sometimes my gums are not in the best shape. And I don't know if any of you have had that experience where you go for a routine cleaning and then afterwards you just sort of feel punky a little bit, like a little bit, maybe low fever or achy. And that's because when you have inflamed gums and the hygienist is poking around, it's kicking bacteria into your bloodstream.
Mhm.
So that's extreme because they're going at you with metal tools, right? But the same thing happens if you're just eating, right? You've got those pockets of bacteria and it's easy to get some of that into your bloodstream. So you really want to keep your teeth in good shape, because anywhere where you've got pockets of active bacteria, you want to get rid of, right?
Mm.
I have a question. Can you hear me? Are there organizations that can help page us with dental work? Because like I have a hole in one of my back of my mouth and one of my teeth, but when I went to get a consult, they wanted like 22,000, and you know you have to pay half a day of the surgery and half like 3 weeks later, and I can't afford that, and I don't get, and Medicaid doesn't carry extractions and root canals. It's just cleaning and checking. So do you know if there's any organizations available that could help with that?
I honestly don't know of specific organizations that provide that kind of service.
Okay, thank you.
But this is also where, and I have the benefit of doing pediatrics, so there's a lot more resources for people than in the adult world. But there's those private dentists where you walk in and immediately there's all the ads for all the expensive procedures and the fancy this and fancy that. But there's other places that are more public health related that are less expensive. There's the UW Dental School, right? Where, things are much less expensive and easier, So I don't know specific, options, but if you call around, you can usually find something that'll be less expensive, a lot less expensive.
Yeah,
Andrew,
I'm
I have a friend that she is really good at that, and she has everything that she always has to find help with medication, with procedures. I will ask her for you, okay? If she
Okay,
knows of
thank you.
anybody, yes.
Oh yeah, thank you so much, Peggy.
Yep.
Yeah, and I'm happy to touch base with the dental school at UW as well. I'm pretty certain that kind of question comes up very frequently in their clinic. So
Mhm.
yeah, happy to touch base.
Thank you
and
guys. I appreciate that. Oh, by the way, do you guys know if they're going to be doing another one of those health fairs where they were giving away are doing free like pap smears? They're doing like free dental, because I was in California when that happened, and it was at the Seahawks Stadium or whatever.
I am so glad you brought that up. Unfortunately, that's only once a year and they just did it. But for years, I've been trying to get help to get a presence there for sickle cell. And one of the things I'd really like help with there is getting a booth and getting it set up so that people can have us real time look up their sickle cell trait status. So that, if an adult comes that's, was born 1992 or after, that we could look up their testing to see if they have sickle cell trait or not.
yeah,
We
that
can
would
look at
be-
other community ones as well, Kendra, if we see anything. Oh, I will definitely let you know. You're talking, but you're on mute.
Thank you. I appreciate that.
Yeah, no problem.
So
No problem. I think one of the other, which you might have, the term, I think I told you all, the term septic comes up a lot in conversations around sickle cell. Can you clear up what does that mean when someone is septic?
do you want me to go? All
and-
right.
And maybe throw in the difference of that in bacteremia.
Yeah. So usually when we're using, so I think I'll start with that. First, there is an infection, which means there is usually, we're talking bacteria here. Bacteria, they're growing and destroying, damaging some tissue somewhere in the body. It can be a strep throat, pneumonia, skin infection, doesn't matter where it is. So that's one thing. The other thing is bacteremia, which is an infection in which we're finding bacteria in the bloodstream. So if you draw a blood sample and you grow it in the lab, you will find bacteria. And it's more likely that a localized infection in someone with sickle cell disease will become bacteremia. So that bacteria finds its way into the bloodstream and will circulate in the body. And then there's sepsis. Sepsis is when the reaction to that infection is overwhelming. So the amount of inflammation is so big that the whole body is reacting to that inflammation. It is very much, it's associated a lot with bacteremia, but not necessarily. You can get sepsis because you have pneumonia, period. It doesn't, so the infection doesn't have to be in, the bacteria don't have to be in the bloodstream for someone to get septic. Because sometimes we think, oh, widespread infection is sepsis. But sepsis is simply that the amount of reaction of inflammation that's happening is affecting the whole body. And how does that manifest? How do we know someone is septic? Usually the blood pressure changes, the heart rate changes, the temperature spikes. There's all those those vital signs that we talk about that we're always checking. They become abnormal. So the amount of inflammation is so overwhelming that the heart is racing, your breathing is fast, and then most of the time the fear is that we'll get to a septic shock, which is when the blood pressure drops. So the heart is racing, trying to keep the blood flowing, but things are so overwhelming that it can't keep the blood pressure up. So the sepsis is the reaction to an infection, which may or may not be in the blood.
And this ties into what I was saying at the beginning. That can, as Dr. Fritsch was saying, can impact all different organs in your body, right? As you're just not being able to function. And another term for that, which some of you have heard, is multi-organ failure. Many of your organs just aren't working well. Well, meanwhile, sickle cell without infection, if it gets really bad, like I was saying, can start doing that same thing of hitting each different organ and shutting them down. And so sepsis is always scary in anyone. But if sickle cell, you've got two different pathways going on. You've got the sepsis that can shut things down, and that can make the sickling worse, which can shut things down. So that the whole severity and the multi-organ failure can happen a lot faster.
Okay, let's talk about something positive.
Well, I have a question. Well, I'm gonna go to pneumonia. Can I go over to pneumonia? I'm sorry, but
Is that
So what-
positive enough, Ken?
Oh yeah, it's a step
I mean,
up
these
from
are, we've
sepsis.
got docs here. I gotta ask the question. I'm sorry. I'll call you later and talk positive. I'll talk to you about something positive.
No, go ahead, Peggy.
Okay, so with pneumonia, I often hear that, pneumonia, if you have it, there's people that say, well, if you have it 3 times, that's almost like you're a goner or this or that. With sickle cell, it seems like pneumonia happens more, maybe not more than others, but so, I mean, how true is that? I mean, is it like every time you get pneumonia that affects things, organs? Of course it does, I guess, somewhat, but how true is it? How many, because I just heard this, well, he's had pneumonia 3 times, so that means that this, is that true? Or is that just people talking or from somewhere? Yeah.
Well, I'll give you the simple answer is no. It's people might have many pneumonias in their lifetime. But I'll backtrack for a moment and say I had a very dear pulmonology professor when I was in medical school, and she used to ask, like, how many times is it normal for someone to have pneumonia in their lifetime?
Mhm.
And we're like, maybe 1, maybe 2. And then she's like, no, 0. No one should be having pneumonia. So when you do get that, it means something is up with your body, right? Something is making it more likely for pneumonia to happen. Sickle cell disease is one of those conditions. There are several others: cystic fibrosis, and all the other immunodeficiencies that can affect children from birth. So I think there's no magical number that will say, oh, if you have more than X number of pneumonias, your lungs are done. We
Mhm.
know that if you get severe pneumonia and if it's extensive, it's affecting both lungs, there's a chance that only one is enough, right? So there is really no magical number for that. We worry about having a lot of pneumonia because if we understand that you might get scar tissue, you might get problems in the lungs if you're having it several times. But also, I think specifically for sickle cell, it's because maybe there's something else that we should be considering. Maybe we should be changing your treatment to improve your defense against that. Maybe we should check if vaccines are adequate and that they're working for a patient with a lot of pneumonias. So I think I like the idea of thinking it's not normal to have a lot of pneumonias. Let's look more into this. But there's no death sentence associated with the number of pneumonias.
Okay, thank you. Yeah.
And I annoy the heck out of people in the hospital, because if someone's having one pneumonia, I want to figure out why. But if someone's having multiple ones, it's all the more important to sort out, is this just bad luck? Or is there, something going on that we can work together to sort of stop that pattern and cut them off? Because if it's pneumonia after pneumonia, sometimes there's something about way of life, something in the body that needs to be cleaned up. Who knows? Better sickle cell, treatments from our end. But it's really important to track it down and not just accept, oh yeah, it's just another pneumonia.
Thank you.
What are the treatments, the sickle cell treatments for pneumonia?
Well, they might differ a little between children and adults, so I'll speak for the older patients. But in general, we always treat pneumonia in a sickle cell disease patient as a severe type of pneumonia. It doesn't really matter how small and how faint it looks on the chest X-ray. You'll probably bring out the big guns and give the patient broad spectrum antibiotics. Most of the time, it will cause some bad pain on top of it. So it's very common that patients need to be in the hospital or get IV antibiotics. The minimum would be to usually we'll give patients a combination of antibiotics, even if they're going home to take it by mouth. But yeah, usually you will need broad spectrum antibiotics, much broader than we would give to someone without sickle cell disease. And we need to support, like treat the pain, use some strategies to improve breathing. We might need oxygen. I think those are the main things that come to mind.
Okay.
And in pediatrics, it's the same. And one of the things which I know I bug a lot of people about is incentive spirometry, right? It's painful, it's irritating, but it helps open up all the small airways in the lungs. And the more open it is, the better you are. So it's the antibiotics and the medicines, but you also need to work to keep those airways open. And as Dr. Fritsch was saying, you can't do that if you're hurting so much, you can't breathe deep. So it's pain medicine, so you're comfortable, but then incentive spirometry, or if you really can't, something like CPAP or BiPAP to help force those little airways open.
Okay. Thank
What does
you.
that mean?
Well,
What does
let's
that,
pause.
what's the first term that you said? I don't know what that means.
And then after
No.
this, let's take Amna's question because she has her hand raised.
Oh, sorry. I just didn't, what
So-
was the first one you
So
said?
if you know anyone that's had adults with sleep apnea
Oh,
without a mask, there's so many different names, CPAP or BiPAP,
oh, right,
or
right.
all different things, but it's something that forces air into your lungs to force those little airways open.
Okay. Thanks.
Amna, go ahead.
Hello, my question is just adding to pneumonia, like with the numbers. My daughter get like any normal kids, a lot of time cold, and this time she get like at the end of the winter cold, and now she have cold like less than 2 months. So, and she just fight it by herself, like she didn't go to the hospital or anything. I give her like humidifier or put her in the bath, like, and some honey, and she doing fine. Is this something I should worry about, like having like multiple cold? Sometimes her temperatures goes to 100 and just come down, not more than 100, which is I don't need to go to the hospital. I keep calling the nurse and her care team. But I'm a little bit worried. Did this something can just develop anything in her body, like because it's still infection, right? If I'm right. Um, I'm not sure if my question clear or not, but like she get multiple calls during the year. So is this something I should worry about, because I didn't give her any type of medication, just the regular things, natural things?
Yeah,
Yeah.
and I think the big thing is if it involves your lungs, even if it's a low fever, you should be very quick to call and talk about the details with someone, because every situation is going to be a little bit different. And those are the things that can really get worse really, really quickly. So if it's any problems with breathing, anything that where, if it's just in your nose, and dripping there and a little bit of cough, it's one thing. But anything more than that really should be talked out to see if we need to get a chest x-ray and do more. One of the scary things for me is in one study, when they had children with fever and they did chest x-rays, 30% of the time, the ER doctors would not have guessed there was an acute chest there. It's only when the ER doctor got the chest x-ray, they could figure it out, right? And so, to me, if the ER senior attending can't listen with the stethoscope and say something's going on, if I'm talking to someone on the phone, if I'm examining them, I have to really be clear. There's a lot of invisible things going on. And so I'm going to have people checked.
Does that mean you advise me to take her to do X-ray every time to her chest?
I think it's best to go call the team and let them know
Yeah,
all the
thank you.
things that
That's
you
all.
think aren't quite right. Yeah, and then have them sort it out.
Okay.
So did I hear, oh,
What about Ken's good news stuff or positive?
I was about to ask that.
So, positive thing is, what things should we be doing on a yearly basis that will help us stave off some of these things?
All right, great question. We want to make sure that we're keeping track of all the organs, and I'd say virtually any organ can be affected by sickle cell to some degree. But of course, the main organs we worry more about. And we want to make sure that we're not missing any slow changes. Because so far we've been talking a lot about infections, which are really sudden things, and you quickly realize that there's something wrong with the lung or the sinuses or wherever the infection is. But we have to keep track of other complications that don't necessarily happen overnight. I think, especially for adults, we want to keep track of the heart function, and lung function. Make sure that patients get, for example, at least an echocardiogram to check for the heart function. If it's a patient, the person has a lot of pneumonia or has had acute chest, a lung function test might be appropriate every now and then. Many of our patients have asthma, for example, so that would be a good indication to keep a closer eye on that. We want to make sure the kidneys are okay. At least once a year, we want to check the urine to see if there's anything abnormal, if you're losing protein there. Over the years, if you leave that untreated, that can lead to kidney disease, and it will make things more difficult for medications to be excreted from the body. We want to check on the liver, make sure the liver enzymes are normal. For the liver in specific, I like to mention gallstones are always a concern. And I like patients to get that checked regularly in case you have belly pain. You want to know if you already have gallstones or not. And the flip side is, if you had your gallstones removed, then of course, at least that's not a concern if you're having belly pain. We want patients to also, one thing that is not at all associated with how to prevent like infections and problems in crisis, but it's really something that we need to remember is eye disease. Anyone can get eye disease from sickle cell. It's random. We don't understand exactly why some patients get it and others don't. And it doesn't give you any warning. So if you don't get your eyes checked, by the time you feel your vision is off, it might be very advanced. So I think those are some of the examples. The last one I'll point out is, for example, bone scans. We want to make sure that as we get older, we're not losing too much calcium from the bones. It's a thing that osteoporosis happens more frequently and earlier in sickle cell disease patients. We've seen patients even in their 20s having lower calcium in the bones, so we want to make sure that we check that. And it might seem like all these things like take forever to happen, many years, but it is that time frame. After 10 or 20 years of some of those things unchecked, we might be surprised with more pain, with more complications later.
So Dr. Fertrand, when you say all these things, do all these things happen in one setting, in one appointment, or are there several appointments through the, how many? Yeah, so you said a lot of things. And so when does that happen? I mean, and
great question. We try as much as we can to do what fits each patient's schedule, right? I don't think there's a good way to do all of that in one appointment, because we're talking about, for example, you'll need to see the eye doctor, and that's probably not the same place where you would get your bone scan. But we try first to not overwhelm patients with all those checks and spread them during the year. So that way they can all get done, but it's not overwhelming. We want to be smart about like drawing the blood and getting all the blood work that we need. If you need a urine test, you can probably get on the same day you get the blood draw. So we can always try to squeeze in things so it doesn't take that much time. But yes, we want to be mindful of patients' time. It's a lot of things to do. And we always, at least in our clinic, we always tell the patient to tell us like what they prefer. Some people will say, I want to miss 1 day of work and I'm going to spend the whole day and get all my scans. And some patients will say, no, you know what, it's too much of a time commitment. I want to do things as they go. Every time I come to the clinic to see you guys, I can also get one of the scans done. But yeah, it's a lot of work.
Okay, thank you.
And every clinic and hospital system is going to be set up a little differently, right? Some hospitals are really set up where everything is one area, so it's a lot easier doing them in 1 day. Other places it's spread out. You know, now we're starting to do 1 day a month to do the transcranial Dopplers at Odessa Brown, right? But before we couldn't, so every clinic's going to be different. The big thing is talking to whoever is doing the scheduling and asking them if they can try to lump them together in the way that works for you the best.
Okay.
Can I ask in that question, is it if you're not going to a main space that does sickle, right? Like if you're not in Seattle, can you assume that providers kind of know this sense of, hey, these are the things that need to happen every year? Is it helpful to have your own list yourself so you know, so you can advocate? Like I don't know if it's fair to suggest, hey, if I'm working with a clinic that's not necessarily seen a ton of sickle patients, are they still knowledgeable enough to know that these are the things that need to happen every year? Or should we have that information ourselves as well?
All right. The short answer is no. You should not assume that they know that all these things have to happen, which is why I'm more than happy to assist any provider if they want to know exactly what a patient of theirs needs. Because I think we have a general idea, like I can always provide people with a list of things. But then as you find things that are abnormal, you will prioritize certain things and not others. It depends on the availability where the patient is. Like, would I make someone drive 4 hours to get, like, I don't know, a bone scan? Maybe not. Maybe we want to lump this together with some other things they need to do at our center if they're coming all this way. So, but yeah. I think that we want to be very transparent and ask the provider, like, yeah, what exactly is the plan? Even if we're just nudging them and saying, hey, I've heard that there's a lot of things that I should be doing. Yeah, because they can absolutely contact us, and we're more than happy to help people navigate that because it's a lot.
Yeah.
And it's not just outside of Seattle. There are very big hospitals in Seattle where some of the providers know it great and others think they know it and are clueless, and others don't know it but reach out for help, right? And so it's highly, highly variable. And so that's why, especially for adults, what I always recommend is to at least once a year, you know, come to some place like Dr. Fertran's program, right? So they can do an assessment and send a list out to the provider saying, you know, based on this once a year or every 2-year evaluation, you know, we think it's important that they get this study, that study, and all of that to sort of give more guidance.
That's really helpful. Do you think, I'm dreaming, we could, I know that from the pediatric side, they were really helpful, Alex. She worked to just kind of give a basic list. Is it possible on the adult side as well to have a basic list that even for the boards could just be posted on the website that people can go to and say, hey, at least I should ask my providers about these top things. Is that an easy
Yeah,
ask?
I think that's definitely something that we can provide. We just don't want people to think it's a one size fits all.
Right, right. And we just have to make sure we state that, but at least people can have a guideline to say, hey, this is a starting point to begin to have conversation with your providers about, no matter where you live. Just a
Yeah,
thought.
and that's really the tough thing, is that there's a lot of studies which aren't done automatically, but once someone talks with someone with sickle cell, they may start adding something, whether it's a one-time test or an every year test. So lists like that are great, but it's important to know that just because you do all of those, you may need more, right? We try to tailor testing to things that we know are going to have a likelihood of helping us.
Yeah, I just think like getting your eyes checked, and what kind of doctor do you need to see for that across the board might be really helpful, or making sure you go to the dentist at least twice a year. Like those basics might be really helpful to just have, that people can return to, but definitely making the disclaimers on it enough so that people know that it's the beginning, but there will be some specifics that they need to work out with their provider.
I like the idea of having a list. I think it would be a great conversation starter.
I think that's, I'm sorry.
No problem. No, I think it would be a conversation starter, and maybe it will prompt even like the provider to really reach out for help. Maybe they'll look at that and say, oh, I had no idea, and maybe I should be talking to someone who specializes in sickle cell, and ask them like exactly like what I should be doing, and if this is really a whole list that I need to go over with my patient. I think, yeah, I think it would be very helpful, even if only like a way to start the conversation.
Well, and that's where a primary care physician comes in handy, at least for me, because then they have their own laundry list of things that we should do as we get older, and then you incorporate the sickle cell stuff into that. And I think that just kind of makes sense for me anyway.
I love that you said that, Ken. I can't speak highly enough of primary providers who really take care of patients with sickle cell, because even though I have my own laundry list of things that I'm watching out for, primary care providers do other things. Like they will keep track of other things that I am unable to do. And we definitely need that partnership. I think everybody should have a primary provider who can help out. They will certainly simplify certain things. They'll find ways to get scans and labs closer to home, more convenient times than coming to a big center if you don't need to. And that way we can prioritize seeing a specialist. Like, let's say you do have a kidney issue or an eye issue, then you can spend that time and effort to make it to a big center because you have a very specific complication of your own, but not necessarily for everything if you can do it closer to home with the primary provider. It takes off some of the burden of all the scans and labs.
I love the idea about a list. I like that idea because it, not only that, we've talked about, it would really open up the conversation about how can we consolidate this into one appointment, what works for you, what works for me, so I think that's a great idea.
And I think it's most important that the patient knows why they're doing.
Mm-hmm.
Because I hate the idea that I'm just giving a list of appointments and say, do all this. And like, why?
Mm-hmm.
And maybe if you have that idea of what is on that list, then it also makes everyone more aware of the things we're watching. And maybe if you have a new symptom, maybe, right, you can always discuss things in more depth when you know what you're looking for.
All right, friends, any other questions that you want to ask, have dialogue about? You are more than welcome.
I have one. I hate to keep speaking, but I have one that I always want to ask. So when it comes to acute chest, so there's been times where we've heard that people have had acute chest, and whether or not it's true or not, and that's why we lost them. I don't know. I'm not a doctor. I'm not anything, but and then medics go to them there's medics go to their home. And so, when we have the walk, we've had medics come to the walk several times, and they really say, they don't know what to do, always with the sickle cell patient. And some I've heard, and again, I don't know whether this is true or not because I'm not a specialist in any of this, but I've heard that with acute chest, it's important to give oxygen. And so I just wonder a little bit about acute chest and how, how does somebody, if it is something that can happen really quickly and it could be really bad, is there signs? Is there something that they should feel that, some awareness that they should have about that?
So backing up, we're really lucky in Seattle that the quality of the medics is absolutely amazing. Okay. And I think it's really important to keep in mind for them what their role is, right? It's not about them needing to treat acute chest. It's to stabilize people and get them to a center as fast as possible. And so, they will measure oxygen levels. And if oxygen levels are low, they will give it, right? Will oxygen help even if oxygen levels are good? That's controversial, right? The most important thing is if it's low, they will deal with them and they will get them somewhere quick. So I don't think we need to worry about, the medics, that part of it.
I agree. Medics, they might think they don't know what they're doing. They know, because their job is to keep the patient alive until they get to the hospital where we can properly treat it. So I think that's really what they do best. And I think there's unfortunately no miracle drug that they should be giving up front for someone to have a better chance of surviving acute chest. That's not true for other catastrophes, maybe for a heart attack or for a stroke. There are things that they're trained to do because it affects the chances of the patient. But for acute chest, it's really about getting to the hospital and supporting the patient as quickly as possible. For someone with very severe acute chest, we're most likely talking about emergent transfusion, red cell exchange, high potency antibiotics and things like that. And they only get that when they get to the hospital. So I think they are certainly doing what they need to do. What we don't know is who is going to get acute chest and who isn't.
So the key, my understanding then, is the key is that we should know the signs, the early signs of possible acute chest, so that we can be the ones that kind of take the initiative to at least get seen or at least question. And so we get going in the right direction.
Yeah, this goes back to Amna's question, right? Is that acute chest is particularly tough because you could have everything you could imagine: shortness of breath, pain with breathing, fever, splinting where you sort of like are bent one way because it hurts so much, cough. You can have all those things, breathing really fast. You can have all those things, or you can have none of those things. Okay, so it's really about, you know, if you have any lung symptoms, you know, anything sort of more than what's obvious from your neck up, right? It's safest just to give a call and check. And if you also have any kind of fever or you just don't feel right, as well as some of those symptoms, that's all the more important to do it right away.
Okay, so for me, 2 weeks ago, I was coming home from San Diego with mom, and I got sick on the airplane, like 45 minutes to SeaTac, and I got sick. I felt like I was being crushed, you know, and so my chest was hurting me really bad, and so the paramedics had to come on the airplane, you know, and help me off and all that other stuff. But they were asking me, they weren't necessarily familiar with sickle cell, so they're like, but they had heard of it, and they're like, "There's not much we can't do. We just need to get her to the hospital," and that was that. But I want to know, what would that have be considered an acute crisis because of the pressure, the step, you know, I had been sitting down for 2 hours and I just stood up, and so the cabin pressure, or um or could it be like my normal? Because like, what's the difference between acute and chronic chest pain too?
So some of you have heard me go over this many times, but air flights can be really, really hard in sickle cell, and everyone deals with it differently, right? Some patients, you know, do long flights between continents with no problem. And there are adults with sickle cell trait where air flights cause major problems, right? So with air flights, you have to keep in mind several things. One is, on planes, the pressure is, there's the oxygen level as if you're at 8,000 feet, right? So you're like way up, you know, in the mountains. So that's a problem.
Mm.
The carrying air on planes is really heavy and hard. So to make it easier to pack it in, they dry it out. So the air is dry, so you breathe out and you get dehydrated easily, and that's a risk. Sometimes planes are really cold, which is a risk,
Mm.
and sometimes they're really hot, which is a risk. And then, you know, like I say, movement is good. And now you're locked in a seat, right? So it's a setup. So it's really about bringing your own water bottle so you can drink, wearing layers so you can adjust. Even if it's just in your seat, practice deep breathing, shake your arms out, shake your legs out, keep your blood flowing. If you have the chance to get up and walk around, you know, take it. You just want to be as prepared as possible for things, because there are a lot of things that can lead to problems on planes.
Okay.
Yeah, I couldn't agree more. My rule of thumb is to always accept anything they offer in liquid, because that way you keep hydrated and you're gonna want to go to the bathroom, which means you're gonna move around.
That is
Okay.
why I try to get spots near the back of the plane by the restrooms. Okay, that is kind of my rule of thumb, just from experience.
Okay.
And
Yeah,
then,
because
of course, drink as much as possible.
right, because yeah, when the ER got like my test results back, they had said I was like pretty dehydrated and stuff, and so I wasn't sure if was it because did I not drink enough while on my trip, you know, and that's why I was dehydrated, or was it because of what came on at the hospital, like just, you know, zapped me like that.
And when I
And
go
so,
on trips, I prepare a day before,
mhm.
meaning that I get really hydrated before, because I know that I get dehydrated on airplane trips, And
Yeah.
that's how I prepare anyway, just bringing my own water bottle and then getting hydrated
Mhm.
before.
So like before I left for San Diego, I did that. I went to the clinic. I got I think almost 2 weeks prior to the visit, to leave, I went to my clinic on 2 days that I go on, and I got 2 units of fluid, as well as on the last Wednesday before my trip. Not only did I get another 2 bags of IV fluids, but I also got an exchange transfusion. So, my doctor did send us with a letter or protocol in case something happens, and have to go to a civilian hospital or something like that. But we didn't have anything for that, like when I come back from the trip. So like I'm military, so I could possibly go to Balboa and see if, like before my way back, and see if there's an option where I can do that again before coming home, you know. But I always do it before I leave, and and that but on your way back, it's
Yeah, I would
so
hate to recommend that you miss one day of your trip to go to the hospital to get fluids,
yeah.
but it seems like it wouldn't be the worst idea considering that you didn't feel well on your flight back. So I think that's something that you could try to look into. I don't know how easy it is to set that up,
Mhm.
but it could be helpful. But again, you can always like keep hydrated as much as you can, and nothing is perfect, right? Even if you do
Yeah.
get fluids, as Dr. Bender already explained, the airplane is really tough. Like
Mhm.
it's a very difficult environment for everyone. And if you're already struggling with dehydration and with sickle cell disease, it's really hard. So
Yeah.
don't be too hard on yourself. I think you did everything
Yeah.
that you could.
I,
But it's
but there,
really harsh
I
environment.
so I hear about bringing your own oxygen with you, and I think I was able to do that once and in my past, and now my doctor tells me there's this regulation or a rule that if you are not hypoxia, um, it's a number you have to reach on the pulse ox or whatnot, and it had to have trouble breathing for at least like a week or two before the airlines will even allow you to bring oxygen onto the planes now. At least that's what my doctor had found out.
So I think it's important to back up here that most people, okay, for plane flights, even long ones, don't need transfusions, don't need IV fluids, but everyone is different, right? And so this is where very quickly we get into the specifics of what can be done in some situations and what needs to be done. And this is where it's always good to talk with your provider before these trips so that they can come up with a customized plan for you for whatever that may entail.
Kendra, I will say, we have 2 kiddos, and they both have SC. One of them flies fine. The other has had complications flying. And I understand that it was her spleen that was enlarging while she was on the plane, or infarction, I think that is what it's called. And the craziest thing is, in addition to that, I actually have had the same problem on the plane. As a trait carrier, I finally went to the doctor, and they said, and it only happened because I've been flying so much. I wouldn't have probably known this, but there's been years where I have flown and felt really sick on a plane. My mom also has felt sick, and she has C trait, and we just never thought about it. But I went to the doctor after, and they actually checked my spleen because my left side started to really hurt. And she was able to confirm that it had enlarged. We did buy an oxygen machine ourselves. It's a little small one. that we take on the plane, and it has been helpful. It just has to have on the back, you have to have the label that there's a particular brands that you have to use, and it says that it's approved to be on a plane. It's in this red thing. So every time I go in, the flight, whoever you're with has to just check to make sure it's one of the machines that is approved to be on the plane. It's really compact too. I will say for myself and for one of our children, it does help. We still get up, we still drink a lot on the plane, we do all this stuff. It's crazy flying. I don't like flying anymore because I feel like I have to be like an athlete on the plane to make sure. But the oxygen seems to have helped us in our family. So just giving knowledge around if you can bring one on. There are certain machines that you can bring on airlines.
Okay.
And just as you brought up, Foxy, it can happen with sickle trait. I was at Walk one year and met a gentleman who's a sort of high up businessman that does all this international travel. And as we were talking about it, he shared that he always has to leave a day or two before all the rest of his team, because when he lands, he just feels like crap and wiped out, and he needs that time to recover. And we talked about these things of hydration, the layers, the deep breathing, all that stuff. And he reached out to me like 6 months later saying, now he flies just fine. So, everyone is different, but there's a lot of simple things that can make a big difference for both trait and people that have full sickle cell.
Okay. Well, thank you. Appreciate that.
All right.
More positive things, Ken.
Well, for me, it's positive to have a primary care physician because they keep tabs on how I'm feeling. They have this huge schedule of things to do, and if I'm not feeling like it's a sickle cell crisis, but I'm not feeling just right, then I could just go to them. And over time, you kind of build up that rapport with them. And I think that makes a big difference because as you know, with sickle cell, there are docs who know. There are some that Bender was saying that know a little, enough to be dangerous. And then there's some that need to be course corrected. So it's good to kind of build up a rapport with someone because I know that sometimes I have pain or like joint stiffness or something like that. And it doesn't mean that I need to go see Bertrand, but it might be something AVN related or not. It could be just general soreness and old age or something like that.
I agree. I do have a PCP that I see. I have a hematologist. I see different specialists for different things going on, but everything, my hematologist knows everything. He's the center of my care still. But so he's aware of everything going on, and I ask him about everything. Before I get anything done, surgeries or whatever, I run it by him first.
Well, and plus I think too that, if we really engage our bodies into different things, like, for example, I've started to try a little bit more yoga and meditation. And that's been we'll just call it a struggle for right now. but it has been helpful. It is not something that is easy for me, but You know, it also kind of gets your head into a different space. I think that sometimes we are so centered around sickle cell that really we need to understand that there's more to our lives than just sickle cell. That we can do things that really help us emotionally and spiritually, that will help us with our dealing with our sickle cell.
Yeah.
Absolutely. And this doesn't feel like, you know, again, this is a tough one to sit through, but at the same time, the goal tonight was to ask your questions, to make sure that you have a place to come, you have trusted people that you can share and ask questions of, so that you can sit informed, so that you can go out and live your life, right, freely, because you kind of are aware of the boundaries that we have to have in place in order for you to do what you want to do. So I thank all of y'all for sitting on this call. I know it's not the easiest ones to hear, but again, to be informed is a powerful thing. I hope you feel empowered. And I acknowledge that you also probably feel a little bit scared. So we'll acknowledge that fear and frustrated by the limitations of sickle cell, but remember that we're in this together. And we support each other through it. And again, I hope you're walking away taking something with you, maybe that you didn't know before, to help to support you.
Well, Foxy, you really have given me a little bit of insight, because when I was 18, I couldn't wait to get out of the house, simply because my mother was like, hey, you need to be in here with me, not doing anything. And I couldn't understand how she felt. And now you're kind of giving me that little bit of that insight of why she felt that way.
Yeah.
And, yeah. So, and everyone gives me a lot of insight to, how their struggle is different. Everyone's struggle with sickle cell is different. But my thing is that we really need to be able to plan our lives and think about what we want to do outside of sickle cell, because it doesn't, doesn't define us. We define who we are and what we do.
Yeah.
Yeah, like I have sickle cell. Sickle cell doesn't have me.
Right.
It's a mantra I use. But just a side note, well, I have all you guys. Our sickle cell walk is going to be coming up here on June 17th. And we're partnering with the Juneteenth people. So I'll try to get more info to Foxy, but I just want to give you guys a heads up that we're having our sickle cell walk, and it's also a memorial walk. So
And when you say "our," you mean Bremerton, so people know
Bremerton.
where you're coming from. Absolutely.
Yeah,
No
Bremerton.
worries. No worries.
And
we're excited.
If you guys would like, if you have materials you would like, or could send to me, for me to display. If you guys have, we could have like a memorial. If you guys would like bring pictures of our two lost, warriors, and we can incorporate them, because our walk is also a memorial walk for the lady who started its daughter. So, and I think it would be a good idea if we could continue that and make it a memorial for all people, all the warriors we've lost.
Absolutely.
So, yeah. So when I know more, I'll make sure to give it to Foxy, the information.
Okay.
Great, thank you.
Yeah, thanks for that.
Bender, did you have something? Oh, I thought you came off mute, so I wanted to make sure.
Yeah, no, it was just, as people were talking about the complexities and all, just have a low threshold to reach out, right? I mean, I know personally for me, it has to be a big deal before I go and reach out to my doctor, please don't do that with us, I mean, I think we'd much rather you reach out and it be a nothing then take the chance of you not bringing it up and it being something,
Mm,
you know?
absolutely.
Well, and I think that's one of those lessons that we've recently relearned as well, you know, with people that we have lost. So yeah, I think that's a great thing to remember.
Yeah, I couldn't agree
Yeah.
more. I think it's I always try to make it clear that it's not nagging if you're having issues and you need to touch base frequently, because I would hate to for someone to just not tell us what's going on when we could have done something.
Yeah.
I think it's a different situation, that it's so unpredictable with sickle cell. They will want to make sure that everything is really fine and everything really feels okay. It's hard because each day is different for each patient, and people don't feel like reaching out all the time. Like, again, I side with Bender. Like, yeah, to ask for help, it's tough. It's tough to ask for help, but trust me, you feel free to reach out for help. You should ask for help, because there is no way to know without touching base with someone. So I
I
think
also don't want to be seen as a hypochondriac either. So
exactly, that's you said it all, Peggy. Like, don't feel like you're a hypochondriac. It's
oh, it's Kendra.
It's Kendra. We're on the same computer.
Yeah,
Sorry.
sorry.
I'm
yeah.
two people.
Yeah.
I have a dual personality. That didn't tell you. Yeah.
No, but I just
that helps.
There you go.
And
So-
Kendra, it's horrible in the healthcare system where people looking for help are often made to feel like, you know, they're hypochondriacs or they're, you know, bothering them unnecessarily. And that's just a big problem with the medical system.
Mhm.
One thing that can help, and I hate saying this because you shouldn't have to do this, okay? But is just in your question showing how smart you are, right? You know, saying, you know, I've got sickle cell and I've got a fever and a little cough, and I know off it's not anything, but I know fever and cough can lead to acute chest. So, you know, so it primes them that you're not just like complaining about every little thing, but, you know, a framework. And again, you shouldn't need to do that, but that often helps providers take it more seriously.
Okay. All right. Thank you.
Yeah, I've had two friends pass because of hospital negligence and just not believing them and thinking they were drug seekers, and the friend I lost, her mom is the one who started the walk that we will have on the 17th. But she went to the ER 3 times, and she kept telling them, something's wrong with me. I have sickle cell, but this is not a sickle cell pain. I don't know what's going on. And they're like, oh, we'll give you some pain medicine and go. And that didn't happen. She's like, I don't need pain medicine. I have pain medicine. Just give it, I need someone to do tests, figure out what's going on. And they did that like the whole weekend. And Monday morning she passed. And come to find out she had a blood clot.
Wow.
Yeah, I'm really sorry to hear that. And unfortunately, I think we all collect those stories. And I'm really hoping that we hear less and less of that. But it is true. And I will say it's not exclusive of sickle cell. Like, doctors need to listen to their patients. And if you tell me like, this is not my sickle cell pain, no one knows it better. It's really, that's not, I don't need to tell you guys that. I need to tell my colleagues that. But it's true. And again, I think what Dr. Bender just suggested, it makes total sense. Sometimes we just need to push people at least to make certain decisions. It's like, yes, I'm calling because I'm concerned I might have acute chest. Do I need to go somewhere and get a chest x-ray? Do I need to be seen by someone? Because at least it prompts that more like practical decision. Do I need to be seen or I don't need to be seen? And what should I be looking out for that I need to be seen, that I need to call you again, whatever, like what's the next step?
Yeah, and that's also why a lot of us don't like to go to the ERs. We'll go if it's the weekend, we try to hold out until Monday and we go to our clinic, and then, if it's bad enough, we get directly admitted where we don't have to deal with the ER staff and their comments and looks and stuff like that, unfortunately.
Well,
But yeah.
this is part of what we're trying to do here is educate, and so that we can eliminate these issues that happen not only in the ERs but also in the hospitals as well. So
Right.
we need to keep at it. Education's the key.
Yeah, true.
All right. Well, it is time to head out. We plan to go till 8, but this is great. This is really, really, really helpful. Not 8 o'clock, I'm sorry, an hour. Couple of things coming up from task force side so that first of all, if you need to reach out for any reason, I'm going to type our phone number in there. Reach out. We are here to be a community together. If you have further questions, please email them. I will make sure we get them over to the doctors today so that there can be follow-up if there's more questions that come after this, which always happens in my mind. So if that happens for you, feel free to send them my way via text or email. A couple of upcoming events so that Camp Corey is offering sickle cell camp for individuals with sickle cell. You do have to be vaccinated to attend. They are also helping with transportation. I'm going to put our website in the chat, and it will have all of our updated events, including the Camp Corey. You do need to talk to your providers about that because there is some pieces of information that providers do need to complete. But there are a couple of Camp Corey camps coming. Keep in mind the sickle cell camp is in August, the 3rd weekend of August. However, your kids can also go to various camps that Camp Corey offers. And so if that one doesn't work, please look at the other ones. They're also offering family camps. So if you're kind of like, I'm not sending my kid by themselves yet, there are other ways that you can still attend camp. It can be very therapeutic. Let's come back to Ken wanting to have some fun. Camp Corey can be very fun, a great time for your family just to enjoy themselves. In regards to Sickle Cell Walk, you did hear that the Bremertons is in June 17th. The task force has their walk September 9th, and we are doing something new at the end of September, celebrating music. You'll hear more about that coming up. We'll be offering a weekend of fun with music. The last thing, July 1st, we are supposed to do a fun field day in partnership with Odessa Brown. This is going to be a time where we all come together and kiddos will be doing a sickle cell unique field day. I have no idea what that's going to look like yet. So if you're also interested in helping to plan that, we will be in partnership with Odessa Brown at their new Othello building doing a fun day. This is open to all families impacted by sickle cell across the board. So we look forward to having you out. Lastly, there is a form that I put in the chat. We are really trying to do better at collecting data from our time. So if you can fill out that form, let us know how this was for you, how this experience was, what other education workshops you would like us to host. You can add that to your feedback form, but we are asking, please, please, please complete the feedback form. Now, I know some of y'all, I need you to click on the link before you get out of here. Okay, so you can just do it real quick. It's like 5 questions and you can have it done, because otherwise you'll have set the intent to do it and you won't, okay? Because you'll go off to do something else. So please complete that form. And again, we're here to support you. So please reach out if you need anything. Let me make sure I add my email here for you.
What date was the Odessa Brown one?
July 1st.
July 1st, okay.
And all of these events should be on our website. if there's
Okay.
something missing, just let me know.
Okay.
All right, or feel free to email me. All right, with that, I think we're good for the night. Thank you to the doctors.
Yeah, thank you.
Thank you
Thank
very
Thanks
you,
for having
guys.
us.
Appreciate it.
Bye.
Bye.
Click the link, friends.
Oh,
Where is it?
I have it on my phone.
Bye. Thank you.
Thank you, Emma.
Mhm.
It's in the chat. The link's
It's in the chat.
Yeah.
Yeah. Yeah, you see
Okay.
that chat icon,
Yeah.
click that, and then
You see the chat icon?
Oh.
Kendra, my other half.
Get your glasses
Mm.
out.
it
Get your
should be
glasses.
down at the, it should be down at the bottom.
She's got her glasses. on.
Should be. I know.
I'm texting it
Oh,
to y'all.
yeah, there.
Okay, we got it. Okay, thank you. Okay, got it. We
Peggy
got
and Kendra, if you guys can fill it out separately, that'd be great. So I can count it as
it.
separate one.
Yeah, mine's on my phone, I think.
Oh, okay.
Yeah.
I think.
All right, you guys.
Kendra, good to see you. How's San Diego going? She from?
Oh, no, I'm here. I'm sorry.
Oh,
San Diego was amazing. Compared to going down last year, I was there for summer, but coming there now for spring was very nice. We did a couple of tours, toward the San Diego route, trolley routes. And every time people would ask us where we're from and we would say Seattle, they'd be like, oh, so you're the reason why we have this weather, because it would be cold and gloomy and stuff the first week I was there. So it was like, I'm like, man, I left Seattle to get sunshine and stuff, but at least it wasn't as hot as when I went last year during the summer. So, but yeah, so everything was good. I enjoyed myself. Loved being able to hang out with my parents. As you know, I'm a mom and daddy's girl, so
yeah. And they're down there
so, yeah.
for a while now, right?
Yeah, the shipyard sent my dad down there in 2 months ago, I think it was, and though he'll be there until either August, yeah, late August, early September. So it's nice, and plus my brother actually works for the airport, so my mom gets to fly free on
Okay.
standby. So they're really trying to take advantage of that. They went to the Bahamas 1 year and stuff like that. So
Nice.
yeah, so
Very cool. All right, y'all. Well, good night.
Good
all right, good
Good
night. God
night.
bless.
I'm doing my form right now.
Thank you,
Yeah.
ma'am.
No, she's doing mine. She took
Oh.
mine.
Ken, I got a question for
Yeah.
you before you hang up.
All
Yeah,
right,
what
you
up?
guys. Good night.
Good night.
Can I, if I leave,
Love
will
ya.
I still have the form?
Well, you have it because she has it on her thing. Well, y'all can stay on too. I'm trying to
Oh.
finish. Y'all know what I'm trying to do. I'm trying to finish this doggone cruise vacation.
Oh, yes.
What? But I need to look. Y'all all here except Denise. I can call her. Ken, going 5 days. Is that going to work for you?
yeah, yeah, that's gonna work. I mean,
Okay.
um,
And y'all good with this Bahama? I did a short trip.
I was thinking 10 because
Yeah.
you have the 5-day cruise,
Right.
then the day before, then the day after.
Right.
I'm thinking all it amounts to 10 days, really.
Okay. Okay,
Mhm.
great.
I'm with that.
I wanted to make sure because you're still working. So I want to make sure. So I picked the 5-day because it's a little simple. Everybody has never been on a cruise. If anybody felt off or whatever, it's not 7 to 10 days. It's a 5-day. It's basic. It's Jamaica and Bahamas, and we go home. That's the first option. There is an option for a 7-day cruise. I just wanted to see how y'all felt first before any
I can do
objections.
7.
I like 5. What's the 7-day cruise? Where you going?
Same places, but then you add like, I think that route goes like St. Martin. Is that what it's called? I don't know. I'll send it to y'all. But I didn't know.
I thought it was Cozumel and Stirrup. Or
Awesome.
was this the Jamaica one?
I'll have to send it to you. The one that is the 5-day is Jamaica and the Bahamas. I'll send you all the option 2, which is the 7-day one. I'll send that to you. And then I'm gonna
Okay.
go ahead, if everybody feels good, I'm gonna go ahead and call the company so I can start working on a group rate. Does that
Okay,
sound?
what would you all prefer, 5 or 7?
Well,
I'm fine with either or.
Yeah.
I just
5
want to
is
make
good.
sure, I'm terrible. I just want to make sure the weather's going to be good on the ocean.
Yeah,
Yeah.
yeah,
At the end,
5,
at the end
5
of
is
October.
good.
Huh?
5 is good.
Yeah.
Okay, we'll look at that 5 one. It's shorter, but it gets to the places and it'll be first cruise for some, for me, but others. And it'd be a taste.
Yeah,
All right. I'll be working on that now that we have a go from everyone on a group rate.
great. That
All right.
sounds great.
That's all I needed to know, y'all.
Yes.
Okay.
All
And
right.
make sure that you guys get your passports because now's the time to get them.
I
Yep.
think Denise is the only one that doesn't have a passport.
Okay.
Oh, no,
Yeah, mine
Kendra,
just has to be renewed.
I don't know how that, did it expire?
Yeah.
Yeah,
yeah,
so
better
Kendra,
get
get
on it.
busy.
Yep.
I sent you the link on
Yep.
how to do that. So
Yep.
Peggy, we can tell you're reading.
Well, I couldn't change, no, reading, no, I'm just trying to, I've been filling out so much paperwork, you guys, it's ridiculous.
It's okay. I'm just teasing you, girl.
I've got paperwork to look at, all these crazy things they're sending me to sign and scary things, and I'm just like,
Wow.
how
All
come
right,
this?
we're good.
Okay, here we go.
how come what?
I got it. It wasn't letting me change it from 2020 to 2023, but I got it.
Okay.
I
Yeah.
got it.
Good night, loves.
Good
Good
night.
night.
Good
guys.
Love ya.
Discussion.
Good night, ladies.
Good
Good night.
night.
Good night.